Well, hello, Dr. Linda Park here. Today we're going to talk about the tongue. When you go to the dentist, they probably talk about the tongue in the sense of, are you brushing your tongue? Are you keeping it clean? You should brush your teeth like you brush your tongue. But the tongue has a lot of importance throughout our entire body. It affects so many things. Tongue position and strength of your tongue. Nobody ever really talks about that. So today I'm going to talk a little bit about that. We are tooth doctors. That's what we were trained to do in dental school. And we learned about the TMJ, we learned about the tongue, certainly. But nowadays, people are focusing more on it and the importance, because it's something that there are a lot of ancient practices that we had from hundreds and thousands of years ago that were just natural. And now people don't even realize these practices are important. So we're going to talk about a few things today that are quite interesting. Dr. Hal Stewart, who is a dentist, said one time, your tongue is not neutral. It's either working for you or it's working against you. So what ways would it work against you? Well, if your tongue is not in the proper position and you know what to do with your tongue, does anybody know what to do with their tongue? Do you know what to do with your tongue? We're going to learn that today. So your tongue position is going to affect many things throughout your body. What sorts of things? It's going to affect the position of your cervical spine and your head. If it's not in the right position, your tongue can be causing you to have a forward head posture, or it can cause you to have the correct head posture. It can also affect your diaphragm and how you breathe. It can affect your shin. It can affect your big toe, because there is fascia, a sort of connective tissue that runs through your entire body, wraps around your muscles, and helps you stand up straight. But there's fascia that runs from the tip of your tongue all the way down through your cervical spine, through your lungs, through your diaphragm, through your psoas muscle in your hip area, through your thigh, through your knee, all the way down to the bottom of your foot and the tip of your toe. So there are some things that I learned from a really brilliant chiropractor who I'm learning to deeply respect with his knowledge, and his name is Dr. Perry Nicholson. He has a podcast and a YouTube channel and a website called Stop Chasing Pain. I can't recommend enough, and I do very often to my patients recommend that they check him out, because his information is incredible. So a lot of the body information that I'm sharing with you is information I've gotten from him directly through his podcasts and through his YouTube channel. But it's so vital for total body health and health of your mouth to know what to do with your tongue. So some of the things that we're going to talk about today are exercises and training to help you think about your tongue position. Have you ever thought about where your tongue is and where it belongs? Well, it belongs on the roof of your mouth. And another person that I learned a great deal from is a dentist and an orthodontist named Dr. Mike Mew. And some of you may have heard of a technique called mewing. And that's a technique where the tongue is placed at the roof of the mouth, and the tongue is actually an expander. I've talked about this before. It expands the palate. It trains the position of your neck. It helps lymph flow throughout your body. It helps lymph flow from the brain down through the lymphatic system. It opens things up. So the best thing that we can do is have the tongue up on the roof of our mouths. So if you just think while you're sitting there watching, where's my tongue right now? A lot of people have it sitting in the bottom of their mouth, so along where your lower teeth are. This is incorrect tongue posture. So correct tongue posture is up on the roof of the mouth. How do you get it there? Well, it's supposed to be the tip of your tongue on the front part of your palate, the middle of your tongue on the middle part of your palate, and the back part of the tongue on the back part of the palate. So it's the whole tongue on the whole palate. And what that does is open things up and spread things. And this also works the muscles of your tongue, because most of us don't work the muscles of our tongue. The only time we do that is maybe when we're speaking, swallowing, and those are normal activities that we do every day. We're going to talk about some exercises to help train the tongue. And it's amazing, and what Dr. Nicholson talks about is the fact that if you have a problem in your foot with plantar fasciitis, you might actually have a problem with your tongue. There might be a weak spot in your tongue that is not working as effectively as it could. So we're going to talk about some tongue exercises. So I'll start with the first one. This is something that we train in our office when we do orthodontics for young children and also for adults. It's myofunctional therapy. So we call this exercise around the world. Dr. Nicholson calls it, I think, tongue circles, but it's the same basic thing. So what you're going to do is take your tongue and do this. And then you're going to go the other direction. So you're going to go kind of around the clock, clockwise and counterclockwise. And when you're done doing that, for me, I can tell my lips feel looser, the muscles in my face feel looser, my temporalis muscles up here are affected. So all these muscles get turned on and affected by just getting your tongue moving. The other thing you can do is take your tongue and do this. That's called lateralization. So once you do that, you're going to go, wow, I'm really feeling that in the lower part of my tongue, way down here. So those are exercises that are helpful for you. You might struggle with it if you have a tongue tie. And there are different levels of tongue tie. When you have that going on, you may not be able to do that as well as you could, and it might really bother your tongue against your teeth. You may have to have a tongue release. That's something that we do here by laser. Sometimes it needs to be deeper with some surgery, but always, if it is released, has to be followed before and after by exercises to work the tongue and help it to become stronger after that happens. But having said that, you can work those muscles even if you do have a slight tongue tie. So that's one of the exercises. Something else that Dr. Nicholson talks about is to take a piece, he says a paper towel, this is a piece of gauze that I have here at the office, and you actually grab the tip of your tongue and you're just pulling it out and holding it for just a short period of time. You don't want to hurt yourself, and you want to make sure that you're still breathing through your nose when you do this. So here we go. So I'm just pulling on my tongue and I'm feeling it back here. And you can tell when you're done, oh, I worked some muscles there that I don't know that I've ever worked before. So then the next step is to take your tongue, hold on to it, and you're going to go to the right side and to the left side. So I'll demonstrate that as well. Again, make sure you're breathing through your nose when you do that so that you can continue breathing and functioning as you're doing it. When you're done, you're going to feel like, okay, maybe just once a day is enough because you're really feeling that work, or twice a day. Just kind of build it. It's like working a muscle that you haven't ever worked or you haven't worked in a long time. You might be a little sore. That's okay. Just keep working it to strengthen it. Because when your tongue is on the roof of your mouth, I'm going to show you by looking at my jaw underneath what happens when that's the case. So if you look this way, my tongue is laying in the floor of my mouth right now, so you can look at this. Now I'm going to put the tongue on the roof of my mouth. Can you see the difference there? So when my tongue is up on the roof of my mouth, I have a better jawline, and I don't have this flabby business under here. But if my tongue is laying on the floor of my mouth, you can see the difference. So it makes you look younger too. So these healthy habits are things that every parent should be teaching every child and working on themselves. Because if you do that from the time your child is young, understanding where the tongue is supposed to be, then the hundreds of thousands of people that need braces in this modern age maybe won't need them as much, because if you have correct tongue posture, then you're going to affect the shape of your palate. You're going to affect the shape of your arches and the positioning of your teeth. It's going to be more correct than incorrect. Yes, genetics can play a role. However, environment and correct tongue position plays an equal or almost more important role. So this is what we work on every day at my office, and thinking and telling people about these sorts of things and awakening their thoughts about where your tongue's supposed to be. Because if your tongue is living on the floor of your mouth, it's pushing your lower teeth in a way that can affect things. Sometimes I deliver crowns to patients. If I put a crown on tooth number 18 and we get the bite just right and everything, and then they come back and they say, well, this tooth is high now, it hurts me. And when I look at the bite on it, I see, oh, that's not how I left that patient. So the tongue, if it's living in the floor of the mouth, will actually move those teeth out and affect the bite and throw the bite off. And I have to keep adjusting that bite until we get it to a position of homeostasis, so that the bite isn't high anymore, because the tongue's happy with the position of the tooth now. Tongue position also affects airway, because if your tongue is on the floor of your mouth, it's further back in your throat. And if it's further back in your throat, then it affects how well you can breathe. When the tongue is back, your head is forward, you have this forward head posture, and you're going to be mouth breathing instead of nasal breathing. So that's another super important factor in the health of your body, the positioning of your tongue. It's going to narrow your airway and cause you to mouth breathe instead of nasal breathe. And nasal breathing, remember, as I've said before, is diaphragmatic breathing down here, because your tongue and the intrinsic muscles of the tongue are connected, and the fascia are connected to the diaphragm. And so it's going to be stretching and pulling and giving you good breathing, as compared to upper chest breathing of your mouth. So once you become aware of your tongue position, then you think, is it up on the palate, or is it on the floor of my mouth? How do I get it up in the palate? Remember, tip of the tongue in the front, middle of the tongue in the middle, back of the tongue in the back, breathing through your nose. And that will allow you to do so many other things that I just talked about. And to strengthen your tongue, work on those exercises daily. And then once you feel proficient at that, you're going to notice a huge difference in breathing, airway, posture, and your overall health. I hope you found this video helpful. If you did, like it and subscribe to our channel, and look forward to more great content.